I started in high school working in an infectious disease lab and just always had an affinity for medicine. So I'm a medical oncologist, so I'm board certified in medical oncology, but trained in both hematology and internal medicine as well to get to that point. I'm an adult medical oncologist, so my hammer, as I tell people, is chemotherapy, or in this day and age, it's actually more directed therapy sometimes, or more precise medicines that aren't including chemotherapy. I do all cancers, but I do one here on the main campus, and as part of Hillcrest, I am part of the GI team. So I have a subspecialty focus in gastroenterology and GI malignancies. So colon cancer, pancreas cancer, esophageal cancer, amongst others. I think the first thing that we are trying to figure out is a plan of care and a goals of care. What I always say, number one, we have to make sure we have the right diagnosis. And then once we have the right diagnosis, we have to stage them to come up with a treatment plan and a prognosis. Even though you're coming to see me as a medical oncologist, it's my job to be aware of what surgeons do, what radiation oncologists do, and have the whole team come together for an opinion that's in their best interest. I think for sure the people that leave the biggest impression on me are the patients that participate in clinical trials. And there are one or two patients in particular that I can think about who participated, who were really at their end in terms of therapeutic treatment options, and they got drugs and to this day are cancer-free. And so, all I have to do is every day just think about that person when I'm having a bad day and just say, wow, that's a pretty amazing thing to be able to give to somebody, but also to let that person into their world in that way. So I'm a master swimmer, so I get up usually at 5:30 in the morning and swim with the Shaker Master swim team. So that's sometimes the time that I get my best thinking in.